Hey guys, it's Melanie. So I thought that I would do my first official video in the Mommy Makeover series. So this is going to be all about my experience going through a breast reduction and a tummy tuck after having a baby. I want to thank everybody on their positive reaction and supportive reaction to the Get Ready With Me vlog that I did yesterday. And if you haven't seen that, I will definitely link that below. In that particular video, I talked a lot about my reasoning for choosing to have this procedure. You know, just kind of the motivation behind it. You know, how long I have had the issues that I am addressing, and just kind of like the emotional stuff that comes along with that. So just to kind of recap that, I grew really quickly in my chest area when I was a teenager. I went from having, you know, kind of average sized boobs one summer, and then by the next summer having like a double D. So, and then from there it has just progressed into now beyond a triple D, definitely beyond a triple D. I'm still squeezing into those bras though. So for me, a breast reduction surgery has been something that I have wanted ever since I was in my late teens. The only reason I chose not to have it earlier in life is because I knew that there was a possibility that I wanted to have a child, and it was important for me to be able to breastfeed if I was going to have a baby. So I've held off on doing this for quite some time, just because at some point Stella was going to come along, and I just wanted her to be able to get that nutrition from me, and that was really important, and it was absolutely worth delaying having the surgery for that so that she could have breast milk. So now I am going to be 35 in November, and it's time. So unfortunately, also after I had Stella, my stomach muscles were completely stretched out. I will happily admit that I never had really strong stomach muscles to begin with, and so that didn't help in things bouncing back after I had her. My upper muscles are so stretched out because I carried her so high. My lower stomach muscles are not as badly affected, but she definitely did. She did some work on me. So it's not something that I'm ever going to be able to fix. And right now I have what looks like a Santa Claus pooch. It starts really high up, kind of right by my rib cage, and I literally can't hold my insides in. And so it kind of looks in most clothing items that I'm still pregnant. I probably look maybe about 4 or 5 months pregnant. So there's like a definite, like, it looks like I've got either a gut or I'm pregnant, and either one of those I would really rather not have. People thinking, you know, and I don't really care what other people think. That's not the reason that I'm doing this, but I want to feel comfortable, like, in clothing again. You know, one of the things that I mentioned is that, like, I would love to be able to be a person who walks into Target and sees a swimsuit or a bra and, like, is able to buy that swimsuit or a bra and have it fit me. I've never been able to do that. You know, I'd also like to walk into a store and just see like a size medium shirt and know that I can wear that because, you know, it's going to fit me in the chest area. It's going to fit me like in my tummy. You know, I'm tired of looking slutty in clothing because, you know, shirts just are incredibly tight across my chest area. If I do buy them to like fit me and what the rest of my body size is, I just want to feel more comfortable with myself. So that's kind of my reasoning. So let me start kind of at the beginning in terms of, let's start with how I found my doctor, and then I'll talk a little bit about the consultation and costs and stuff like that. So I wish that I would have been able to get a referral from someone, but I don't really run in a circle of people who readily have cosmetic procedures done. So I really had nobody to ask in terms of, you know, who would be a good person to go to. You know, there are some names that kind of popped into my head just based on you know, these people appearing on like local radio shows and talking about cosmetic procedures or like commercials and stuff like that. But unfortunately, most of those doctors were kind of specializing in breast augmentation in terms of like, you know, implants. I don't need any implants. I've got implants to spare. Like if anybody wants the extra boobage, they are welcome to it. So I had to start Googling, and I just Googled breast reduction in the area where I live. And there were some names that popped up, and so I just kind of started going through those websites, looking at before and after pictures, reading about the doctors, you know, just trying to get a better sense of who these people were and like why they do what they do. And the one particular doctor that stood out to me, she sort of specializes in breast reconstruction and breast reduction and mommy makeover type things. You know, she certainly does other things in her practice, but I think that those are the things that she appears to sort of pride herself on. And I really like the fact that she does do a lot with, you know, breast reconstruction for breast cancer survivors. That's, you know, it shows that she, that's not an easy thing to do. It's a difficult surgery. It's, you know, like it's a very like highly charged emotional kind of procedure, and the fact that she specializes in that kind of drew me in a little bit to her. And she had amazing before and after pictures on her website. So I called and made an appointment. It took me about a month to get in to see her. And, you know, in the meantime, I just kind of started looking more and more into what breast reduction surgery entails. I started watching a lot of YouTube videos, reading blogs, you know, and then also came, you know, in combination with a lot of breast reductions, I saw a lot of tummy tucks happening. So these like mommy makeover things. And I came to realize that, you know, even though I've done sit-ups and, you know, I mean, I obviously haven't done anything like super consistently, but I have noticed that even when I do sit-ups, like it's really hard to do them because I really lost like every single ounce of muscle tone in my stomach when I had Stella. And like I said, I never had good muscle tone to start with. And so I really kind of am like way behind in the game. And I also started learning that it is extremely difficult, if not impossible, to fix your muscles after they've been stretched out the way that they have. So, and I knew that like the stretch marks would never go away on their own, and I knew that the extra skin that I have, which I have a decent amount of, is never going to go away. So I can lose some fat around my stomach area, absolutely, there's definitely some fat there, but not a ton. It's just extra skin, and it's a lot of stretch marks, and it is a lot of like torn apart stomach muscles that like really, you know, the doctor told me like I could do hundreds of sit-ups for like the rest of my life and it would never look the way that it did pre-baby. So that kind of clinched it for me, you know, and Craig and I had talked about it, and you know, we just kind of figured if I was doing the breast reduction, we might as well, you know, talk to the doctor about a tummy tuck as well to see what that would entail. So I had my appointment yesterday, and here's kind of what the experience was like. So her office is, it's in another town, and so we went. It was very clean, just very like neat and organized and welcoming, and the staff were really friendly. You know, I had some like check-in paperwork that they had mailed to me, so I just brought this packet with me with all of these like history questions that I had answered and personal information, and so they created a file for me and then called me back. You know, it was great because we were able to bring Stella, and she was very welcoming of bringing our baby. You know, most doctors I think would probably be like, ugh, can you like leave the kid at home? You know, because it's distracting, but we just didn't have a sitter to be able to leave her with. So they called us back to an exam room, and a nurse, you know, took my blood pressure, which was a little bit high because honestly, like I really got nervous on the drive over there thinking like, oh my gosh, I'm probably really going to do this. And that's scary. So my blood pressure was a little bit high, and she said that that was fine. Like it's kind of normal. And so she starts going through my history and, you know, just asking about my health and surgeries that I've had and all of that jazz. And so, she took all that information down and then, went back and talked with the doctor, and then the doctor came in, and she was super, super nice from the get-go. She interacted with Stella, which sounds like it shouldn't even be part of this video, but it was important to me that, like, she was a warm and caring person, because I really, I want to be able to connect with my doctor. I want to be able to trust her and just know that, like, she has my best interest, and good for her to obviously see that I'm a mother, and so this isn't an easy decision for me to do this. So anyway, she interacted with Stella and was just very welcoming, and I had changed into a gown in the meantime, bra obviously off, still had my pants on, and she went ahead and just started asking me some questions, like my motivations for doing this, what my end goals are, asking me like how I tend to heal after surgeries, how I heal after, I get a cut and scars and stuff like that. So everything sounded pretty good to her. Then she went ahead and did measurements. So I opened my gown and she took a tape measure and measured my breasts, and they wrote all that stuff down, and she then took out a couple of implants and showed me how much, she just wanted me to have like a physical like object to be able to hold to show like how much she thought she would take out. And so she had a 300cc implant as well as a 200cc implant. And so she was thinking that she would probably suggest taking out somewhere between 200 and 250 cc's of, I guess, like breast tissue, but it's, it obviously wouldn't be cc's of breast tissue. It was just, the implant size. And I actually felt more comfortable with her removing more. I preferred the 300cc implant, which would have removed more tissue, because my goal in the end is to be a small C cup. I don't want large breasts anymore. I don't need them to feel sexy. I would just rather be small and more comfortable with myself. That is more important to me than looking proportionate or looking right in the long run. So, she respected that. She said, I really think because of the way that your body is built, you look pretty athletic and you have broader shoulders. Like, I want to make you look proportionate, but I also want to respect that you want to be on the smaller end. So she said that, if I decide to move forward, all I would have to tell her is the morning of the surgery, I really want you to remove just a little bit more. And then at that point, she would absolutely do that. But it was very important to her to have me be proportionate in the long run and be happy. I told her that, one of my goals was to not have, like, my breasts be saggy afterwards, so that, I could like hold a pencil or a piece of paper underneath them. Those of you with big boobs, you know what I'm talking about. Like, you can put a pencil underneath your boobs if you lift them up and put them down, like, and that pencil stays there. Like, I didn't want any boob left to be able to lift up and like hold things underneath, not that, like, who does that, right? But it's totally like, I was trying to like explain to her that I really just want these puppies like where they're supposed to be normally. I don't want any sagging. She kind of shared with me about how the breast reduction works. So, she would have to do the anchor incision with me because of the amount of breast tissue that she would have to remove. So I'm going to have a scar underneath my breasts, one going up vertically, and then there's kind of like that lollipop incision that they do around your areolas to make them smaller, because that's also something that they have to do that has to be proportionate for my new smaller boobs. So, it would probably look something like an anchor with that circular incision around my areolas. And I'm not worried about scarring. That is not something that would ever keep me from doing a surgery like this, just because I don't walk around naked. I just don't care. And if anybody sees me changing at a gym someday and they're like, oh my God, she has a scar on her boobs, like, I don't care. I don't walk around naked. I'm not a stripper. Like, I don't make money off of my body. So, the way that the scars look afterwards really isn't a big deal. And my scars tend to heal very nicely. So that's not something that I'm really concerned about. So, you know, she took pictures of my boobies, and, you know, but before we get to like the picture portion, you know, Craig reminded me like, oh, did you want to bring up the tummy tuck? So I did. And, you know, she went ahead and did an exam on my stomach. And when I first like really like opened my gown for her to be able to see my stomach, she was like, oh yeah, girlfriend did a number on you. She really did you in. Which was kind of validating to hear because, you know, like, I mean, I know that. Craig knows that. Like, anybody who thinks that I'm still pregnant, like, you know, knows that, you know, either I'm fat in my stomach or, you know, like, or I'm pregnant. Like, that's kind of, I think, what people think. And again, not that I care about that. I care about what I think, and it's uncomfortable to me. So, you know, she did an exam on my stomach muscles, and she was like, I mean, she said they were completely like separated, and especially in the upper portion. The lower portion wasn't as bad, but she was like, honestly, there is no way that you're ever going to get those to come back together. Surgery is really the only way to do it. So if that's something that you're interested in, we can absolutely fix that for you. She said, you know, this is the amount of tissue that we would remove and then pull down, and then we will put your belly button right here. And she kind of explained how they do the procedure, and I'd seen like YouTube videos on it, so I know that it's graphic stuff. They kind of cut you in half. You have a long scar across, you know, the bottom, like by your bikini line. Again, I'm not worried about the scar. I'm not going to be walking around naked. If somebody happens to see it in a swimsuit that I'm wearing in the future, I don't care. I mean, I'm never going to be ashamed of doing this. And if somebody thinks like, oh my God, that girl had to have like a tummy tuck because she couldn't do it on her own. Like, yeah, no, I couldn't. Like, it's just, it's not going to happen. I didn't hit the genetics jackpot. You know, this just wasn't, it's not in the cards for me to have a perfect body after having a baby. So, you know, whatever. If I had to have surgery to do it, then that's fine. So scar wasn't really a big deal to me. You know, what I was obviously worried about is the recovery time. I am doing this procedure, but I'm going to have it done hopefully in early December so that I have pretty much all of December and January to recover from this. You know, I'm not planning on doing any weddings during this time. It is just going to be like Melanie gets to heal and, you know, get her body back to normal after what is bound to be a very like traumatizing experience. So, you know, it was great just talking to her about it and having her be very honest with me about, you know, the pain afterwards. And, you know, she talked about where the drains would be and how long they would be in for. And, you know, with just doing the breast reduction, if I just did that procedure, I would basically go to the hospital, have the procedure, and go home. With the tummy tuck and the breast reduction, I would have to stay in a, it's like a hospital hotel for at least one evening after, and that's just a requirement. So I would have nurses that would take care of me that entire evening, and the next day the doctor would come in, check everything, make sure it's fine, and then at that point I would be able to go home. So, you know, I kind of figured that if I did both, it would probably require a hospital stay. So, anyway, it was a good experience. She explained everything in depth. I was able to get my questions answered, and Craig was able to get his questions answered, and you know, Stella was there for the whole thing. So, not sure how dysfunctional that was, but she had no idea what was going on. Although it was funny when she was measuring my boobs, Stella was like, no, like, she didn't like that for some reason, because I think she was like, those are my boo-boos. So anyway, let's go ahead and talk about the cost. So after the doctor left, they went ahead and put some quotes together for me. So I'm going to share those numbers with you just so you have a sense of what it's like. And I'm in the Pacific Northwest. Costs are going to vary greatly by surgeon, by, you know, the hospital where they have privileges to do the surgeries and all of that stuff. So this is just a rough estimate, just based on the part of the country that I'm in. So my consultation fee was $50, but that $50 is put towards, you know, the overall cost if I decide to book the surgery within a year of having the consultation. So that $50 will then get applied to the final total. They also invited me to they're having kind of like a party for their patients where, you know, they talk about different procedures that they do, and they have like raffles, and it's just like a girls' night out kind of thing. And if I go, I would get $500 off a single cosmetic surgery treatment. But since I'm going to be doing multiple and that is already discounted, I would get an additional $250 off my mommy makeover, essentially. So $250 plus that $50, so like $300 right there would be subtracted from the totals that I'm going to be telling you guys about here. They also, you know, are going to do like raffles for like a free year of Botox, which would be awesome to win, and then like winning a Clarisonic and a Peel and all kinds of stuff. So I went ahead and I told my business partner that she's coming with me to this party, and that if she wins the Botox, she is going to be passing that along to me, because I don't think she would ever get Botox. She totally doesn't need it. She doesn't have like this super overly expressive face that I do. So anyway, that's something that I'm going to be going to. And I figured, you know, why not? It's another $250 off the surgery, and it's a fun night out with girls. So they told me about that. Then they did 3 different price quotes. I'll tell you about just the bilateral breast reduction. So the surgeon's fee would be $5,300 for that. The operating room expenses, and this is a 2-hour surgery, would be $2,000. The anesthesia for that, for the full 2 hours, would be $945. And then there is no miscellaneous fees. For a total for the bilateral breast reduction would be $8,245. Now, that does not include the mammogram that I have to go get prior to the surgery. It does not include the pathology that is going to happen when she sends the tissue to the labs to be examined. So essentially, after she does the breast reduction, she sends the tissue away just to make sure that there is nothing abnormal that, you know, I need to watch out for. So it's essentially just making sure there's no like cancer cells or anything like that. So it's a cover your ass thing for the doctor. So, you know, and it's always good to have that. So anyway, those things would not be included. And again, I would not need a cosmetic hospital stay. So anyway, there is that. It is $500 deposit to book the surgery, and that is, you know, put towards the surgery. And so the payment is due in full 2 weeks prior to the actual surgery date. So we would essentially have to pay everything in full 2 weeks before the surgery date. They do take, you know, credit cards. They take personal checks. They take money orders. They also have a program called Care Credit. So this is something that Craig and I applied for because they do have 12 months no interest. So we're going to go ahead and do that. And we could afford to pay for the surgery outright, but we figured since it was 12 months no interest, we might as well just spread it out over the course of a year. So I applied for this and qualified. So yeah, this is always an option. So anyway, that was for the just the breast reduction. So she also did one just for the abdominoplasty, which is the tummy tuck. The surgeon's fee for that is $5,200. The operating room for that particular surgery is $2,600, and it's a 3-hour surgery. So it's an hour longer than just the breast reduction. The anesthesia for that is $1,197. The miscellaneous fees would be $135. That includes the garment, the foam, and the garment that is like a compression garment that you wear on your tummy afterwards, and then also leg sleeves, which essentially I think prevent you from getting clots in your legs after surgery. So it just like massages your legs. So the total for that is $9,132. Again, it's $500 due at the time of scheduling, and then full payment 14 days prior. So there's prescription medications that obviously come along with that. So this is additional expenses that aren't included in that total that I just told you. There is the required stay at the R&R Cosmetic Hospital. It's $600 a night, and we pay that directly to the hospital, and then obviously any revisions. So if surgery doesn't go as planned, I am responsible for those fees in the long run. And here's the cat. Kiki, go away. So anyway, that is just for the abdominoplasty. And then they gave me a third quote, which includes the tummy tuck as well as the breast reduction together. So you get a discounted rate by doing both. So the surgeon's fee is $8,420. So it is discounted, you know, instead of paying let's see, $5,200 and $5,300, they're giving you a discounted fee. The operating room expenses, because you are paying for, it's a 5-hour surgery now that I'm doing both, it's $3,800. The anesthesia fee for the 5 hours is $1,701. And then there is the fee, the miscellaneous for the $135 for the compression garment, the foam, and the leg sleeves. So that total for that surgery is $14,056. So the surgeon's fee can be covered by the care credit, but the hospital does not take care credit. So we have to pay out of pocket for the operating room fee of $3,800 and the $1,700 for the anesthesia. So, which isn't a problem because we have a savings account that we can take that out of. So again, you know, with this, it also doesn't include the pathology, the mammogram that I have to have, as well as the hospital stay of $600. So I think if you add all of that stuff together, it's probably going to be about $15,000 total for everything. So that's a hefty financial commitment. And let me just kind of tell you guys just financially where I'm coming from with this. So we have a good savings account. When I worked full-time and when I ran my business full-time together, everything that I made from my wedding planning company, I put into savings. And so we have a good savings account. You know, I never spent any of that money, so I have a lot of money in savings from that because it was basically my entire income for a few years from the wedding planning business. I did certainly use some of that in the last year, you know, to pay for bills and stuff like that, but there's still a very good chunk of that left. You know, and before anybody thinks that we're going to be sacrificing like anything having to do with Stella to be able to do this, we still put $200 a month away for her college savings plan. We still put money in savings. We put money in retirement. So this is in no way going to affect us negatively financially. It's an investment, I guess if you could call it that, but it's not something that I'm going to go into like major debt for. So like I said, we could pay for it outright, but we are choosing to put it on this care credit card because we can spread the payments out. So that's what we're doing. So we're putting the surgeon's fees on here, and then we're paying the hospital fees out of pocket, essentially. So that is the cost of the procedure. They, you know, I don't want to like show you because this has like my personal information on it, but it's just basically 3 different sheets of paper that she drew up with like the information kind of put out. So I need to probably schedule my surgery soon so that I can get a date in early December. She even mentioned that there were dates available for surgery in October. Right, so I have no idea where that cut me off, but it cut me off because this video is already at least 29 minutes long. So what I wanted to kind of finish off with was that I need to schedule my surgery soon so that I can have a date in December, because December books up quickly. Most people choose to have their cosmetic procedures during that time because it's a good time of year to do it. Most people have time off of work. So anyway, I need to go ahead and I need to talk to Craig and see when we can do that. So that is pretty much all that I wanted to share in this video. If you have any questions, definitely leave me a comment down below. I will be doing more series or more videos in this series of, you know, like mommy makeover experience here. So if you have specific requests, definitely leave those down below, and I'll be happy to do videos about special requests. So anyway, there you guys have it. It's, you know, that's how I found my doctor. That's how much it's going to cost. That's how we're going to pay for it. And yeah, hopefully it all works out for the best. And again, I just really want to thank you guys for the support and for being so encouraging. I know it's something that is a very personal decision, and not everybody is going to agree with it. And it's something that I've thought out very well, and something that I've researched extensively for a very long time. So it's not something that just popped into my head one day, like, oh yeah, I'm going to like get a tummy tuck and I'm going to get a breast reduction. Like it's been a long time coming, people. So yeah, again, if you guys have any questions, leave me a comment down below, and I will see you in my next video. Bye guys.